Welcome and thank you for tuning into A Sound Constitution at CHLY 101.7 FM with Cassandra, Sam, Carla, Kelly, Max, and Harris. We're fourth-year Bachelor of Science in Nursing students at Vancouver Island University in Nanaimo. We're working to demystify healthcare issues affecting our community, bringing you evidence-based information about our healthcare. This information is for education purposes only and does not replace the advice of your primary healthcare provider.
We would like to start our show by acknowledging that we are on the unceded territory of the Nanaimo people, with a broadcasting range that overlaps the Kuwatsan and the Sliaman territories. This acknowledgement is done with gratitude to the Nanaimo people and with the intention to increase awareness about truth and reconciliation processes and efforts on Vancouver Island. Additional information and resources surrounding Nanaimo history, reconciliation, protocol, and land acknowledgement can be found on our Facebook and YouTube pages.
Hello there, and welcome to an episode of A Sound Constitution. My name is Harris, and I will be your host, joined by my esteemed co-host Kelly. Today's topic is about cardiovascular health. Please join us today as we discuss the ways in which you can improve your or a loved one's cardiac health, dispel myths, go through the steps of addressing a cardiac emergency as a certified first aider, as well as discussing various cardiac conditions and the differences between the signs and symptoms of a heart attack between men and women. Lastly, we will talk with a heart transplant recipient to hear their story on their experience with transplantation and how it has changed their life.
As fourth-year nursing students, both Harris and I have had the privilege to do a portion of our practicum on the cardiac floor at Nanaimo Regional General Hospital. We both learned so much when working on that floor, and we would like to share some of our learnings with our listeners. So here it is. What are some of the common illnesses we see on the cardiac floor? Let's start with dysrhythmias. These are disorders of the formation or conduction of the electrical impulses within the heart. They can be diagnosed by using the ECG, but often palpations and monitoring heart rate can also indicate that there might be something wrong. They may also initially be evidenced by the hemodynamic effect they cause. Say, a drop in blood pressure because a change in conductions has also affected the pumping action of the heart. This is why monitoring your heart rate and blood pressure is very important on the cardiac floor, not that it's unimportant on the other floors. For most people, the cardiac impulse occur at a rate ranging between 60 to 100 times a minute in adults. Some patients may present with bradycardia. This is when your heart rate is less than 60 beats a minute in adults. Bradycardia can be caused by lower metabolic needs, such as when people are sleeping, hypothermia, hypothyroidism, and people who went through athletic training can also have lower heart rate than those who are not very athletic. Certain medications and vagal stimulation can also cause your heart rate to drop. Tachycardia, on the other hand, is when your ventricular heart rate is greater than 100 beats per minute. This can be caused by acute blood loss, anemia, shock, hypovolemia, congestive heart failure, pain, and fever, but it can also be caused by exercise and anxiety. Patients who are about to undergo surgery will usually have an elevated heart rate because they're nervous about surgery. Another very common dysrhythmia we see on the cardiac floor is atrial fibrillation, commonly known as AFib. This causes a rapid, disorganized, and uncoordinated twitching of atrial muscle. So your heart can be divided into two sections. The top section is your atria, which can be further divided into left and right, and the bottom is the ventricles, which can also be divided into left and right. So when we say atrial fibrillation, we're talking about the twitching of the top section of your heart. It may start and stop suddenly, or it can be a chronic thing. It is commonly associated with advanced age, hypertension, coronary artery disease, heavy alcohol consumption, and pulmonary disease. In many patients, AFib will convert back to sinus rhythm. A sinus means your heartbeat goes back to normal within 24 hours. According to the Mayo Clinic, although AFib itself is not a life-threatening illness, it does require proper treatment in order to prevent stroke. Some people with AFib don't even notice any symptoms, but some will have signs and symptoms such as dizziness, chest pain, shortness of breath, and a sensation of this fast fluttering or pounding heartbeat, and usually an ECG will be ordered just to help with the diagnosis. Some dysrhythmias can be treated by cardioversion and defibrillation. This is what people usually tend to think about when they think of the cardiac floor. The doctor holding the pads, they rub them together and they clear. These two procedures use an electrical current to depolarize a critical mass of the heart cells. It's kind of a wake-up call to the heart cells that are not working properly, so it's kind of they're knocking on the doors to get them back into their normal rhythm. However, there is one major difference between cardioversion and defibrillation, and that is defibrillation is usually an emergency treatment. This is when you're watching TV, you see doctors on TV, they're running a code, that's defibrillation, where cardioversion, on the other hand, it's usually, but not always, a planned procedure that requires patients to come into the hospital or we pull them from the unit into a special part of the hospital to get cardioverted. To those of you who are just tuning in right now, you're listening to A Sound Constitution at CHLY 101.7 FM. We're fourth-year nursing students at BIU, and we thank you for joining us today. Let's talk about coronary vascular disorders. Coronary artery disease is the most prevalent type of cardiovascular disease in adults. In 2008, according to the Heart and Stroke Foundation, of all the cardiovascular deaths in Canada, 54% were due to ischemic heart disease and 25% due to heart attack, and these are related to your coronary arteries, so it's definitely a very important one to focus on. The most common cause of cardiovascular disease in Canada is atherosclerosis, which is an abnormal accumulation of lipid or fatty substances and fibrous tissue in the lining of the arterial blood vessel walls. These substances create blockages and narrow the coronary arteries. These are blood vessels that supply blood to your heart, so they're very important. Because of this narrowing, there is a reduction of blood flow to your heart muscles, which causes a repetitious inflammatory response to this injury. And this inflammatory process, after it damages the arteries, can also attract platelets, which can initiate clotting. These deposits or plaques can protrude into the lumen of the vessel, or they may become unstable, so they lodges off and then lead to a thrombosis formation, which then obstruct blood flow, causing an acute myocardial infarction, which is the death of a portion of the heart muscle. Prevention of this includes controlling cholesterol, physical activities, and certain medication that lowers lipids, cessation of tobacco use, managing hypertension and diabetes. Doctors can also use some procedures such as placing stents to provide structural support to a vessel at risk of closure, or surgically remove the plaque through shaving, grinding, and cutting. Another common illness we see on the cardiac floor is heart failure. This is the inability of the heart to pump sufficient blood to meet the needs of the tissues. Many of you know that the blood carries the oxygen needed by the body, and the heart is responsible for pumping these oxygenated blood to your tissues, while taking the deoxygenated blood back to the lungs so it can receive the oxygen you breathe in. In heart failure, however, there is an issue of fluid overload and inadequate tissue perfusion, which causes the heart to become unable to pump enough blood to meet the demands of the body. Often, heart failure is progressive and is managed with lifestyle changes and medication to prevent an acute congestive episode. Depending on which side the heart failure is located, patients may have many different symptoms. For left-sided heart failure, common symptoms include shortness of breath, decrease in urine output due to this decrease of blood flow to the kidneys. Because the left side of your heart is responsible for pumping blood to the rest of your body, left-sided heart failure can cause inadequate blood supply to some of the other organs in the body. If it's to the digestive system, say, then it could alter digestion. If it's to the brain, then it causes dizziness, lightheadedness, and anxiety. Increased heart rate due to inadequate blood supply is also a common symptom. Right-sided heart failure, however, can cause fluid buildup in your extremities. This is commonly called edema. For patients with right-sided heart failure, there is an inadequate blood return back to the heart, which causes accumulation of fluid, especially in your ankles and feet, which is why sometimes on the cardiac floor, we'll elevate the patient's feet so that the blood returns back to the heart through the force of gravity. We hope you learned a little on some of the common cardiac illnesses we see in the hospital. Thank you for tuning into A Sound Constitution at CHLY 101.7 FM. With cardiovascular disease being the leading cause of death in many countries, it is important to learn some prevention methods on how to maintain a healthy heart. We have a TED Talk from Dr. Michael Rocha, a cardiologist with Hawthorne Medical Associates, to talk about how to keep your heart from killing you.
So I had just finished my walk around Buttonwood Park, and I was headed back to my car when I spotted Ken. Ken's 50 years old, and he'd never been health conscious since I had known him, so seeing him out for a walk was a little unusual. I didn't expect what he was going to tell me next. Last May, he was driving to work, and all of a sudden he started to develop a severe squeezing sensation in his chest. He couldn't breathe. He felt like he was going to vomit, and he started to have drenching sweats. He knew he was having a heart attack, and somehow, despite all those symptoms, he was able to drive himself to the hospital. And the first thing that he thought about when he got to the hospital was about his 3 sons being fatherless. Within a day, he had open heart surgery to bypass severe blockages in his heart. And Ken had been given his second chance. Unlike his father, who passed away at age 51 of a massive heart attack, Ken was now making the most of his second chance. Now, as a cardiologist, I know that we've made some incredible advances in the care of heart disease over the last several years. If your heart loses its beat, we can pace it. If you have a severe blockage, we can bypass it or we can put a stent in. If the pump becomes weak, we can actually put a device that can help it pump. And we can even replace a failing heart with another heart. Our ability to treat heart disease has changed certain death into a day or two in the hospital. But we still lose far too many people in the prime of their life. So how can we keep your heart from killing you? Is it really only pills and procedures? Is that the only thing that we have to offer? Now, in the last several years, we've learned a great deal about the importance of lifestyle through many studies. We learned that being sedentary was twice as deadly as being obese. And the researchers in that study suggested that just 20 minutes a day could significantly reduce your risk of death. In another study, we learned that 4 out of 5 heart attacks could be prevented with very simple things: eating healthy, exercising, not smoking, and maintaining a normal waistline. A Mediterranean diet, which is rich in vegetables, fruits, nuts, olive oil, fish, beans, and whole grains, while limiting sugar, dairy, and red meat, was shown to reduce the risk of heart and vascular disease by 30%. And we also learned that you're 5 times more likely to have a heart attack in the 2 hours after an angry encounter. So you have to ask yourself, is it really worth that last argument you had with someone? So we've learned the great importance of how lifestyle affects our heart health. Yet too often I hear from other doctors that people won't change their habits. I disagree. This is me. This is me in medical training. And to think that 7 years before that picture was taken, I was the starting point guard on a state championship basketball team at New Bedford High School, dribbling the ball up and down the court at the Boston Garden. That person there couldn't dribble a basketball without getting short of breath. And it took a wake-up call from one of my mentors as a cardiology fellow. And Nat looked at me one day and he said, you're fat. And how are you going to be able to talk to your patients about living healthy if you're not? And you know what? He's completely right. I wasn't living it. So I started to eat half of my portion sizes and I started exercising more. And my weight went from 230 pounds to 180 over a couple years, and now I'm finally down to 150 pounds. However, the other thing that I was struggling with was with my stress. And stress is something that as doctors, we don't usually like to talk about, but it's something that's very important. We usually push on, and we oftentimes don't take care of ourselves. And I'm not alone. About 50% of doctors are actually burned out. And if we're going to take better care of our patients, we need to be able to take better care of ourselves. I didn't have the tools in the toolbox at that point in order to deal with my stress, and it was affecting every part of my life. I was surviving my weekdays and crashing into my weekends. And this kept repeating itself with no end in sight. Fortunately, a vacation to San Diego where I met this man changed my life. Jean-Pierre Marx is a behavioral and spiritual therapist, artist, health and wellness instructor, and a grand master of martial arts. He introduced himself while I was looking at some of his art, and after speaking with him, he gave me his book, Wake Up to Life. When I read this book on the plane flight back to Boston, I realized there was a lot more to well-being than I had learned just in medical school. And those that had known the old me would be surprised to find out that I was studying such things as mindfulness, yoga, and healthy eating. So it was at this point that I realized that the fog had lifted. And this painting in my home of Jean-Pierre marks when I changed from surviving to living. And we've become great friends, and he continues to impart wisdom. So the fog had lifted. I could now see that heart disease could be preventable through lifestyle, and I was trying to do that myself. Scripts in the office were being written for healthy eating, yoga, meditation, exercise, and laughing. And I kept going in this direction because patients were actually doing it. They were quitting smoking, they were losing weight, they were exercising and overall happier. One patient looked at me and said, "So what you're trying to tell me is that we should be eating from farms, not factories." She really got it. I was learning that being a heart doctor was a lot more than treating the physical heart. It was about helping patients realize that they are their own best doctors. Dan is a vice president of a major corporation who is a self-proclaimed workaholic. He was working long hours overseas on a project and not taking care of himself. He was eating fast food and his clothes were no longer fitting him. He wasn't sleeping and he wasn't exercising. And he had none of the typical risk factors for heart disease. He didn't have diabetes, he didn't have high cholesterol, and he didn't have hypertension. But one night he started to develop severe squeezing chest discomfort. But of course, it couldn't be a heart attack because he had none of those risk factors. He kept brushing it off. But when it wouldn't go away, he had his friend take him to the nearby hospital, where the tests suggested that he was in the midst of having a major heart attack. But he still wouldn't believe it. So he actually had placed a phone call to me before he would undergo any procedures. And that was the longest second opinion of my career, 8,000 miles away. I was on the phone with another cardiologist and Dan discussing what was going on. And it was clear he needed to have a stent placed. And that was done, and he had almost no heart damage. When he returned to the United States, he came to my office and put this down on my desk. And he said, "This caused my heart attack." This R2D2 USB charger was the project he was working on when he wasn't taking care of himself and he had his heart attack. He blamed his unhealthy lifestyle and his stress as the cause of his heart attack. And he was on all the right medications, but he still wasn't in balance. And during that visit, we talked about eating vegetables, reducing the amount of sugar, exercising more, and sleeping more. And he did all these things. And the shortness of breath that he had after his heart attack resolved, and he's had no further chest discomfort. He realized that his life is more important than R2D2. However, we shouldn't have to wait for a wake-up call, an emergency like that. This article was in the local newspaper. New Bedford was one of the least healthy places in the state of Massachusetts to grow older, and a large part of that was because of heart disease. This problem was a lot larger than could be tackled one-on-one in the office. This is when I started to think more like a coach than as a doctor, and laced up the sneakers. On the first Saturday in April of 2014, we had a wellness walk around Buttonwood Park. At this 2-mile walk, we had people from all over our community, including people that have had heart attacks, stents, open heart surgery. And it was this weekend that the New Bedford Wellness Initiative was born, with the mission to raise health awareness, prevent disease, and recover from illness. Social media actually was a great platform, as Facebook proved an easy way to get information out quickly. We were able to let people know where the farmers markets were, where there was exercise, where there was yoga, meditation, healthy restaurants. We also started to have community-sponsored events, such as hosting health documentaries and national speakers like Dr. Don Berwick from the Institute of Healthcare Improvement. We also, because last year, as we all remember, we were under about 2 feet of snow, we moved our walks into the mall. So we kept our momentum going. And the group was starting to take on a personality of its own. This is Caesar. Caesar's pretty much a celebrity of our group. He's a person that struggled with his weight and underwent gastric bypass a few years ago. He now gets up almost every morning, and before work he walks 6 or 7 miles a day, and he shares these posts on Facebook. Caesar's not only decreased his risk of having a heart attack, he's been an incredible inspiration for others in the group to change their habits. Loretta LaRoche is a friend of mine. She's a humorist, stress specialist, motivational speaker, and author who's been participating in our group since it began, with her humor and wisdom on our Facebook group and also through workshops. What we have to realize is the value of humor is undervalued. And she really is the doctor of laughter medicine for us. In that spirit, we've tried not to take ourselves too seriously. And we've had tie-dye yoga Fridays at the hospital and red nose days in the office. And like I talked about before, it's really hard to have an angry encounter that can increase your risk of having a heart attack if you're laughing or smiling. Over the last month, we've actually had the opportunity to take the next step. And we've started a wellness program at the local Boys and Girls Club with free programs in aerobics, nutrition, smoking cessation, meditation. We've also learned that it's important for us to grow. We need to partner with other groups. And we've been able to partner with the National Walk with the Doc. And tomorrow will be our next walk. We've also partnered with the 100 Million Healthier Lives movement, which has a bold goal to improve the lives of 100 million people by 2020. So this is our prescription in New Bedford to hopefully prevent you from having to see a cardiologist. It's pretty simple, but the data suggests it's effective. Walk, eat healthy, laugh often, and live now. And this slide was designed by my friend and patient, Mike. And Mike is somebody that I met several years after his heart attack. But in the last few years, Mike has increased his walking. He practices yoga and meditation. And he's so proud of his healthy cooking that he shares it on Facebook with us. Mike's been able to transform his life and prevent himself from having another heart attack. I'm grateful for the opportunity to return to my hometown and practice medicine and share these stories with you, which motivate me every day. We're building a community in New Bedford that is taking one step at a time to prevent heart disease. So can your community. Get moving, get healthy, and be well. Thank you.
To those of you who are just tuning in right now, you're listening to A Sound Constitution at CHLY 101.7 FM. We're fourth-year nursing students at BIU, and we thank you for joining us today. Welcome to the Mythbuster segment of today's episode, where we list some of the common misconceptions related to health. Today's focus is the cardiovascular system. Misconception number 1, heart disease is a man's problem. Since 1984, more women than men have died each year from heart disease. Heart disease is the leading cause of death in women over the age of 65, just as it's the leading killer of men. Men and women also exhibit different symptoms in certain cardiovascular diseases, such as heart attack. We will talk about these signs and symptoms later in the episode. Misconception number 2. Cardiac arrest and heart attacks are the same thing. A heart attack occurs when one of the coronary arteries, these are the arteries on the surface of your heart, becomes blocked. Because of the blockage, the heart muscle can't get its vital supply of blood and will begin to die because it's not getting enough oxygen. This is a circulation problem. A cardiac arrest, on the other hand, is when a person's heart stops pumping blood around their body and they stop breathing normally. This is an electrical or conduction problem when the heart suddenly stops beating. Misconception number 3. Heart failure means the heart stops beating. The heart suddenly stops beating during a cardiac arrest, like we talked about in the second misconception, not heart failure. With heart failure, the heart keeps on working, but it doesn't pump blood as effectively as it should. It can cause shortness of breath because your body's not getting adequate amount of oxygen, swelling in the feet and ankles, which we call edema, or persistent coughing and wheezing. Misconception number 4. If you have a heart disease, you should eat as little fat as possible. It's true that you should have a diet that's low in saturated fat, partially hydrogenated fat, and trans fat. But other fats, notably the unsaturated fats, which is found in vegetables and other food, are beneficial. In fact, eating fish high in omega-3 fatty acids, such as salmon, twice a week can lower the risk of heart disease. Misconception number 5. Angioplasty and stenting or bypass surgery fixes your heart. Angioplasty and bypass surgeries can do wonders for relieving chest pains, so angina, and improving the quality of life. But they don't stop the underlying disease, which is atherosclerosis. Without correcting the problem that contribute to atherosclerosis, arteries will continue to become clogged with fatty plaque, which can mean returning of the angina, or worse, a heart attack or a stroke. This means after undergoing angioplasty or bypass surgery, it's important to correct the problems that lead to the need for the procedure, such as high cholesterol or blood pressure, a poor diet, smoking, or lack of exercise.
Next, we have Philip Gleim, a former principal who now lives in Saskatoon, Saskatchewan. Phil's life drastically changed when he was diagnosed with a genetic heart condition that required him to get a heart transplant. Fortunately, the procedure was a success, and Phil continues to be grateful for the second lease on life that he has been given. Phil spends his days retired and being involved with the Canadian transplant community, participating in the annual transplant trot and competing in the transplant games. I was lucky enough to sit down with him and ask him a few questions about his experience with being a transplant recipient and how his life has since changed. So without further ado, here is the interview. Thanks for joining our show as a guest today. So first, can you tell us a little bit about yourself?
I'm 61 years old, married, have two grown adult daughters and three granddaughters and a fourth one on the way. And I'm a retired high school principal, been retired since 2013.
As I previously stated in my introduction, you received a heart transplant. When did you receive your transplant?
I received my transplant in 2008 in Edmonton. So it's been 13 years since I got my heart transplant.
So can you explain to the audience why you need a heart transplant? What health issues did you have?
Well, in 2006, right at the beginning of the summer holidays, actually, I was out in my backyard and I was using a chainsaw to trim some trees, and suddenly I couldn't breathe. And over the course of the next couple of months, after lots of visits to emergency, we came to the conclusion that I had an irregular heartbeat, and my heart would race up to over 200 beats per minute, which would cause me to be very lightheaded, and it's also a very dangerous thing. So, and then I spent the next 2 years in and out of hospitals in Saskatoon, Calgary, and Edmonton, going through all sorts of procedures until they came to the conclusion in March of 2008 that the only remedy for the symptoms that I was experiencing was a heart transplant. So that's how I got to the point of being listed by the heart transplant program in Edmonton. And I could go into detail of all kinds of things. I had a defibrillator implanted. I had 4 ablations where they burn parts of your heart to try to stop signals from making your heart race. I was on so many different kinds of medication. It was a really, really tough, horrible 2 years. So I was really pleased when in March of 2008, Edmonton decided to include me in the heart transplant program.
To add a little bit to that, can you tell our listeners what sort of heart condition you were diagnosed with?
Yeah, it's my mother had a heart transplant in 1997 after many, many years of all kinds of problems, health issues, a stroke, and different things. And in the fall of 1997, she was offered the opportunity to be part of the transplant program in Edmonton. And so she took that. And all of us thought it was just a one-off, that it was just mom and her health issues. And then in 2006, when I started experiencing my symptoms, and I also had a couple of uncles who were also dealing with heart issues, my cardiologist suggested that we do some genetic testing. And so we did that at the University of Saskatchewan. They sent all of the paperwork down to Harvard University, and it came back that there's a gene that a number of us share. In my family, there was 5 kids in my family. 3 of us inherited that gene from my mother. 2 didn't. And so it's dilated cardiomyopathy is what it is, where your heart just gets larger and larger and larger. And the larger it gets, the less well it functions, to the point where you're just not getting enough oxygen into your blood. And it's very difficult to even do menial tasks without being really, really short of breath and lightheaded.
Thanks for elaborating on that. What's the process in receiving a heart transplant? How long did it take you to get a new heart?
Well, like I said, my symptoms started in 2006, July of 2006. It took me until March of 2008 to be accepted into the heart transplant program in Edmonton. And that was after, as I indicated, a number of different procedures, a number of different medications, more trips to emergency than I can remember, because when my heart would race, the only way that they could deal with that is they had to shock my heart back into rhythm. And that happened, I would guess, in excess of 25 times during that time. And so I got I got it included into the heart transplant program in March. And then after undergoing about 5 days of tests in Edmonton in the hospital, making sure that I was healthy enough to be a recipient of a heart, they then had a meeting. And thankfully, I got a phone call on a Monday morning from the individual that worked with outpatients in the heart transplant program. And she indicated that no one around the table, which included a bunch of doctors and nurses and specialists, no one around the table could find any reason why I wouldn't be a good recipient. So then between March and August, when I actually received my transplant, there were lots of trips from Watrous, which is where I was living at the time, which is about an hour out of Saskatoon, so 6 hours from Edmonton. There were lots of trips to Edmonton to see doctors, to have tests done, and so forth. So, I used to use the expression that being listed in the heart transplant program is like a lottery ticket. You can't win the lottery if you don't have a ticket. And it's the same thing with the heart transplant. You can't get a heart transplant unless you're accepted into the program. And for me, the most difficult time for me was knowing that ultimately that was going to be the cure for me, but having to jump through so many hoops over over a year, just about 2 years, I guess. In fact, it was 2 years before I finally got my transplant. But and that's because there's just not enough organs, right? There's just not enough hearts out there, and so the people that they put in the program, they want them to be really, really good recipients. And if you get one of those rare hearts that's donated, that you're going to take care of it and you're going to be healthy enough to accept it and to get better.
So what did day-to-day life look like after the procedure? Were there any difficulties you had after you had your transplant?
Well, actually, interesting. The surgery itself went really well. And when I came out of surgery, everything looked great. And then about a day after my new heart was implanted, it stopped beating on its own. And so they hooked me up to a pacemaker, an external pacemaker. And for the next 5 days, I was on an external pacemaker, and there was talk of implanting a permanent pacemaker in me. And because they couldn't figure out why my heart didn't want to beat on its own. And then one of the specialists got thinking about the medication that I was on before my transplant. And I was on a very, very powerful medication that's designed to keep your heart from racing and having palpitations. And the consensus was that I was on such a high dose of that, and I had such a large amount of that in my body that it was keeping my new heart from beating. Anyway, to make a long story short, on the 6th day, as every other day, a heart specialist would come through intensive care, which is where I still was at that time, and look at all my vitals and everything. And I was laying in bed, and he started dancing around. It's like, what's going on? And he said, your heart started working. And so it was great. My heart started working on its own, just like that. And that day they moved me into a private room on the ward and out of intensive care. And then I was out of the hospital within days after that. And then I lived in Edmonton for just about 3 months afterwards, because I had to go to the hospital every day for physiotherapy and different appointments and so forth. And after just before 3 months was up, they allowed me to go back to Saskatchewan. But every day I got better and better and better. And it was wonderful, because before my transplant, even brushing my teeth would make me short of breath. Tying my shoes, I'd be short of breath. So, I mean, it was a miracle.
So moving forward to the present, what do you currently do to maintain your cardiac health?
Well, I take a handful of pills every day. I think I have 7 prescriptions. 2 of them suppress my immune system so that my body doesn't try to reject my heart. And then there's other medications for blood pressure and cholesterol and different things like that to deal with some of the side effects of the immunosuppressant drugs I'm on. Diet's really important. Exercise is important. And I'm very lucky in that once a year, I go to Edmonton for annual appointments around the date of my transplant and see a whole bunch of different specialists and have different tests done. And then also once a year, I do the same thing with the transplant program in Saskatoon. So every 6 months, I have a bunch of very, very talented people meeting with me and going over my blood test results and echocardiogram results, ECG, bunch of different kinds of tests. So I'm very fortunate. I'm one of those people that gets excellent health care. And so that's all part of it.
So you've had your transplant for over 10 years now. What can you tell our listeners about the importance of transplants and being an organ donor?
Oh gosh, I think there's a misconception out there that people who get organ transplants are really sick, and basically I think there's a perception that an organ that's donated just saves somebody's life. But I don't think the average person really realizes how much the quality of one's life is improved. And I indicated earlier that I went through some really, really tough times for the 2 years prior to my transplant. I went back to being a principal of a high school. I finished my career, put in 4 years after my transplant, so that I could retire with 30 years in on my terms. I went back to reffing football, running up and down the sidelines, reffing basketball, running up and down the basketball court, coaching high school sports. Both of my daughters got married. My grandchildren were born. I mean, so many milestones have occurred in my life since my transplant. And nobody, unless I tell people that I've had a heart transplant, nobody knows, because I don't look any different than anybody else. The only difference for me is that my heart is now a pump. It's not connected to my brain, because when they remove your heart for a heart transplant, all the nerve endings are cut and those don't regenerate. So my heart is basically a pump. So it pumps blood through my body. And if you were to scare me, my heart wouldn't race. My heart wouldn't speed up. If I need to run, I have to warm up so that my heart speeds up, and then it doesn't slow down like other people's do quickly. So that's really the only limitation. And it's really not a limitation because I haven't allowed it to be a limitation. So my day-to-day life isn't a whole lot different from the average person, other than I take a bunch of medications, and my heart works differently than other people. And my resting heartbeat is 100 beats per minute, as opposed to the average person, which is 60 or 70 beats per minute. So overall, my life's great. I've been very fortunate that I got a very, very healthy heart. I know nothing about my donor. That's a wonderful thing about the country that we live in, is they protect the privacy of organ donors in this country. I know nothing other than I believe that I got the heart of a woman, because I'm way more emotional now than I ever was before my heart transplant. I think I'm a better person than I was before.
Yeah, made you more empathetic. So.
Oh yes, I think so.
Do you have any advice you can provide to individuals who may be going through the process of needing a transplant?
Yeah, I think there's a few things. First of all, if you can talk to the people in the transplant program and see if they can put you in touch with somebody that's been through it. My wife had really had a hard time with the listing and the waiting and not knowing if or when it was ever going to happen. And they were able to put her in touch with someone else in Saskatchewan that actually had a kidney transplant, but went through the same sort of feelings that we did. Be a really strong advocate for yourself. Sometimes it can feel like nobody understands. And I think it's really important as an individual and a patient that you really make things clear to your healthcare providers and advocate for yourself. You really need to be optimistic. And I think one of the things that I did, which was just kind of random, is there was a very popular book out at the time. I can't remember the author, but basically it was all about living now and not worrying so much about the past and the future. And that's what really got me through the last number of months leading up to my transplant, is learning just to appreciate every day and not worry, because you have no control over it, because as you know, unless you're getting a kidney transplant or a liver transplant, you're getting an organ from a deceased person. And you don't know when that's going to happen. You're not the only one that needs a heart. At the same time as I was listed, there were a number of other people. And with the technology that we have today and the ability to transport organs a fair distance, you're not just competing with people that are waiting in Edmonton, you're competing with people in other places. So you have to be optimistic. You have to believe that eventually it's going to be your turn, but you also have to just appreciate every day, because there is absolutely no guarantee. And I know that because two of my brothers passed away, and both of them would still be here today if they would have been fortunate enough to get a heart transplant.
Lastly, do you have any resources or organizations to plug regarding heart transplants or transplants in general?
Yeah. When I got out of the hospital, my wife had learned about this. I joined a national group called the Canadian Transplant Association, CTA, and ultimately ended up being Saskatchewan's, the president of the Saskatchewan chapter, and was on the national board for a few years. And the goal of the Canadian Transplant Association is really to provide encouragement for people who have gone through the transplant program and provide them with some guidance, I guess, in terms of diet and those kinds of things, and exercise. Also, the CTA promotes organ and tissue donation. And we've got signs up in hockey rinks all over Saskatchewan, about being a donor. And things have gotten much better because now we have a provincial registry in Saskatchewan, which we didn't have until a couple of years ago. But the biggest thing that the CTA does every year is they hold the Canadian Transplant Games, which I've been fortunate to attend on many of them. Since my transplant, the games have been in Quebec City, Calgary, Moncton, Toronto, Vancouver, and next year in Winnipeg. And people from all over Canada, organ transplants, compete in athletics, and I've done very well in the sports that I've chosen. I've golfed, I've long jumped, I've run the track, I've bowled, race walked. I've done a number of different activities, and it's just wonderful to get together with people from all over the country and their spouses to get together. And yeah, it's a wonderful thing. So Canadian Transplant Association has been a big part of my life. And I really strongly believe in what it stands for, and it's a nonprofit. And so, we encourage people to donate to it. And like I said, most of the money either goes back into promotion of organ and tissue donation, or it goes into the Canadian Transplant Games.
Well, I just want to thank you so much for joining me today. You're
welcome.
To those of you who are just tuning in right now, you're listening to A Sound Constitution at CHLY 101.7 FM.
Did you know that men and women experience heart attacks differently? This is because historically most studies are centered around middle-aged Caucasian men. It is because of this, women are often at greater risk of misinterpreting or minimizing their heart attacks as believing that they are experiencing gastric reflux or came down with the flu. As a result, women are often unaware that they are having a heart attack and until after they've had one. On one hand, this speaks to the resiliency of women for enduring the pain and discomfort through their various stages of lives. But on the other hand, it shows a lack of exposure on the resources on the subject. In a survey conducted by the American Heart Association, about half of the women interviewed knew that they had heart disease leading to the cause of death in women, yet only 13% said it was their greatest personal health risk. Additionally, women also cited that they were more concerned about breast cancer than the heart disease, even though heart disease kills 6 times as many women every year. So how do we address this issue? For starters, we can identify the signs and symptoms of a heart attack in women. As a nurse in training, it is my pleasure to share this information with you so that you can pass this along to others in your lives. Let's first start with how heart attacks are similar between men and women. As with men, women's most common heart attack symptoms are chest pain or an uncomfortable pressure, squeezing, fullness, or pain centered in their chest. It lasts more than a few minutes but goes away and comes back. Other symptoms are pain or discomfort in one or both arms, the back, neck, jaw, or stomach. Shortness of breath, which may or may not accompany chest pain, is also another symptom. Another common symptom between men and women is an irregular heartbeat. It may be faster or slower than usual. It is important to note that normal heart rate is between 60 to 100 beats per minute, but it is important to know what their normal is. These signs and symptoms are likely what you are familiar with, and probably are the first things that come to mind when you think of a heart attack. However, this is where the similarities end. If we are to consider the symptoms that are different between women and men in regards to a heart attack, the symptoms are sudden dizziness, a heartburn-like feeling, cold sweat, unusual tiredness, and nausea or vomiting. It is important to note that the signs and symptoms will vary person by person, and symptoms of a heart attack may be immediate and intense. More often, though, some symptoms start slowly and persist for hours, days, or weeks before a heart attack. The critical thing is that you or a loved one pay attention to their symptoms and call 911 if a heart attack is suspected. Education and awareness are critical to saving the ones that you love. So we've talked a lot today about different kinds of cardiac disease, but you may be wondering, how can you help? One option is you can investigate resources with your primary healthcare provider, and you can promote a healthy lifestyle that benefits yours and others' cardiovascular health. However, what I would like to talk with you about is the importance of becoming a certified CPR and first aid. Being a first aider is great because it allows you to be trained with skills that allow you to quickly respond to accidents to ensure that injuries can be efficiently and promptly dealt with before a trained medical professional arrives to administer a specialized treatment. You are directly able to contribute to saving someone's life. Best of all, it takes only a weekend to become certified, so there's my pitch for becoming a first aider.
We hope you enjoyed today's episode. We encourage you to reach out to your healthcare provider for more information. As always, check out our Facebook page for resources for today's show. If there are any topics you'd like to hear us discuss, let us know by email at asoundconstitution@gmail.com. Thank you for listening to A Sound Constitution on CHLY 101.7 FM.